Rebecca is a 3-year-old female, history of a 34-week preemie requiring a 3-day NICU stay at birth before being discharged home at 35 weeks. She presents today to the urgent care with cough, fever, and difficulty breathing. Mother reports patient has been having a cough for 6 to 7 days now. Reports cough is worsening and is now more productive over the past 2 days. Mother does report that she has been breathing heavier and faster, and now you can see her belly when breathing, and this all started yesterday morning. Reports fever for 2 days, Tmax 103. Reports decreased appetite over the past 2 days and hasn't been drinking as well. However, mother has been encouraging fluids and does feel like her hydration status has been maintained. Reports 2 voids today. Denies any vomiting or diarrhea. Patient has been complaining intermittently of generalized abdominal pain. However, mother reports pain resolves on its own. Last bowel movement was yesterday, and soft, denies blood and stool. Denies dysuria. Mother has been giving patient ibuprofen to help control fever. Last dose was given about an hour and a half ago. Mother has also been giving Robitussin to help with the cough. However, does report that it's not really helping. Denies any known ill contacts. Patient does attend preschool 3 days a week. Denies any recent travel. Patient does live at home with her parents and younger sibling. Mother does report that patient has a history of RSV at 8 months of age. However, did not require hospitalization, was able to be maintained at home. Denies any other history of wheezing and has never required a bronchodilator. So as mentioned, patient is a 34-weeker requiring a 3-day NICU stay with CPAP for 1 day. Mother denies any other hospitalizations other than at birth. Surgical history, patient has a history of recurrent otitis media that require laryngotomy tubes. However, mother does think the tubes have fallen out since that time, and no ear infections since that over the past year. So vital signs, patient is 14.8 kilos. Her heart rate is 148, respiratory rate 42, temperature 101.9, SATs 94% on room air, and blood pressure 94/68. Patient does report 2 out of 10 on the FACES pain scale, however does not localize any pain. So upon assessment, upon entering the room, patient is alert, talking with mom, however appears to not be feeling well. She's sitting on mom's lap with her head on her shoulder. Her cheeks are slightly flushed, and you can tell that she's working harder to breathe. Her eye exam, pupils are equal, round, reactive to light, no conjunctival erythema or injection, no discharge. Her nose does have some mild rhinorrhea. Her ears, tympanic membranes have mild erythema, no loss of landmarks. You're able to visualize the cone of light. She does have a mild amount of scar tissue on both tympanic membranes, which is most likely related to her prior tube placement when she was a baby. Her mouth, her tongue is midline. She does have slightly dry lips, however, moist mucous membranes. Her throat does have some mild erythema. Tonsils are 2+ bilaterally, no injection, no exudate, and no oral lesions. Her neck, she does have full range of motion of her neck. She does have a few mild anterior cervical shoddy nodes bilaterally, no pain with palpation, all mobile, and no jugular vein distension. Her cardiac exam, patient is tachycardic. As mentioned, her heart rate is 148. She does not have a murmur, it's a regular rhythm. Her pulses are strong. Cap refill is brisk at 1 to 2 seconds, and she is warm to the touch and pink. Her lung assessment, as mentioned, patient is tachypnic. Heart rate or respiratory rate is 42. She does have some mild subcostal and supraclavicular retractions. Her cough is loose and harsh and pretty persistent during the exam. No cyanosis. She does have some upon listening to her decreased aeration with crackles in the right lung fields, and then few faint scattered expiratory wheezes throughout. Abdomen exam, she does have active bowel sounds, no distension, soft with palpation. She doesn't seem to be in any discomfort with palpation upon exam, or no pain, and no splenomegaly. Skin is dry and pink. She's slightly flushed, as mentioned, otherwise no rashes. And she does have full range of motion of all of her extremities. So problem list for her in the past, 34-week prematurity. She does have a history of otitis media that required laryngotomy tubes, and then RSV. Her current problem list is fever, increased work of breathing, cough, decreased appetite, and intermittent abdominal pain. Some differential diagnoses for Rebecca: a viral respiratory illness, pneumonia, pneumothorax, pleural effusion, influenza, or sepsis. The impression of Rebecca, again, she is a 3-year-old female with fever, cough, and increased work of breathing for the past several days. Upon exam, she does have tachypnea with retractions and crackles, vocal crackles in the right lung fields. So due to the symptoms and clinical findings concerning for possible pneumonia, she is able to maintain her stats greater than 90%, and she is stable at this time and hydrated. However, we will continue to monitor for increased workup breathing. So my plan for Rebecca is to obtain an AP lateral chest x-ray to rule out viral burst pneumonia and make sure she doesn't have a pleural effusion or pneumo. Administer acetaminophen 12 milligrams per kilo to control her fever and possible help with tachycardia and see if this helps improve her overall clinical presentation. Due to her few wheezes and some respiratory distress that she's having, we'll trial an albuterol neb treatment, 2.5 milligrams per 3 mils of the 0.083%, just to see if this can help resolve the wheezing and help her breathing a little bit. And then we'll continue to monitor her oxygen saturations as well as her vitals, making sure that her stats stay greater than 90% of her mare. And then encourage fluids since she seems to be tolerating fluids well. So after my plan and x-ray has been obtained, albuterol neb is now completed, patient is now clear of wheezes, and now just with focal crackles in the right lung fields. Her chest x-ray findings are back and do show that she has right lower lobe pneumonia, which is consistent with the clinical findings that we found on exam. No other abnormal findings on the x-ray. Patient's vitals are now slightly improved. After monitoring her for an hour, the albuterol treatment and the Tylenol. Her heart rate is now 122, respiratory rates now 30, temp 100.4, oxygen saturation is down 96% on her mare, and blood pressure 94 over 69. She's drinking fluid, she's active and ambulating around the exam room, now with very mild submuscular retractions, wheezing completely resolved. So the plan is she is able to be discharged home. She is stable and can be managed as outpatient. She'll be discharged home with amoxicillin for bacterial pneumonia, 90 milligrams per kilo per day, BID for 7 days. And then due to the improvement with albuterol, also plan to send Rebecca home with albuterol inhaler, 90 mics. She can have 2 to 4 puffs every 4 hours as needed. And then encourage mother to follow up with her primary care provider in the next 1 to 2 days just so patient can be watched. Thank you.